Okay, so our final speaker today is Professor Jamie Pearce from the University of Edinburgh. Jamie is a professor in health geography, but is speaking today with his Administrative Data Research Network hat on. So thank you very much.
No, thank you, Michelle. Thanks, everybody. This talk hopefully will follow on seamlessly from Mark's. It's almost as if we planned it, because what I want to do is talk a bit more broadly about some of the activities going on up north of the border around big data, around administrative data, and talk particularly about the Administrative Data Research Centre Scotland and how that connects to the wider network that Mark mentioned just a moment ago. But at the same time talk about another resource, something called the Scottish Longitudinal Study, which I hope will also be of interest. And as you'll see, it meshes quite neatly with some of the questions and some of the ideas that relate to obesity that we might be able to answer, we might be able to think about using some of these administrative data resources. So hopefully that will become clear as I go through. So what I want to do is to think about how these two particular ESRC funded resources, the Administrative Data Research Network and the UK Centres for Longitudinal Studies, can be used in questions relating to obesity. I'll say something about the introduction to the services, give us one or two examples of the data that could be used and to answer some questions that relate to obesity, and just a couple of issues about access. And I'm sorry the font has gone rather peculiar in the email submission to Michelle yesterday, but hopefully you can read that rather peculiar looking font. So just as a bit of a background, the ADRN, the Administrative Data Research Network, this is all about linking administrative data and potentially census data for 100% populations. And the key point here to make about the ADRN and the ADRC, Administrative Data Research Centre, the one we have based in Scotland, is that we don't actually hold any data. There aren't any actual data sets, which is the point where the audience often looks rather disappointed. But we don't hold data sets for a good reason. What we're about is the infrastructure for bringing together data from all sorts of different sources in ways that are hopefully quite novel and innovative to answer particular research questions. And of course they could be related to obesity, but we have social scientists, health scientists working on a range of questions. And I'll say a little bit more about this in a minute. But the key point here is that we potentially can bring back together data sets to create large populations for all sorts of different sorts of analyses, potentially millions of individuals, because the data are restricted to the way in which the data have been collected and the questions that have been asked. Often the data are not collected with the purpose of answering questions, for example, around obesity. They're collected for very different purposes. So we have to work within that sort of framework. At the same time, we also host within our centre the Scottish Longitudinal Study, which is one of the longitudinal studies in the UK, one of 3 longitudinal studies in the UK, which between them offer 40 years of follow-up samples of around 300,000 to 500,000 people. And this is, again, bringing together census data, vital registrations, education data, and gives us lots of detailed information about households. And of course, this is information that's been purposely selected for social science research. It gives a smaller, but nonetheless equally valuable, potentially valuable resource for answering some questions related to obesity, as well as all sorts of other issues. So just say something quickly about the 3 longitudinal studies, the ONS study in England and Wales, the Scottish Longitudinal Study, which we'll talk about in a moment, and the Northern Ireland Longitudinal Study, which Ian's somewhere in the audience who can tell you much more about this than I possibly can. Just as a way of example to those of you not familiar with these data, this is trying to show you just one individual that potentially could exist within the longitudinal study. So this person entered at the 1991 census. The census is the starting point for the collection of the longitudinal data, and then through all sorts of vital information, vital data, we know quite a lot about them. We know, for example, that they got married soon after the 91 census. They were admitted to hospital with an appendicitis. They had a first child, a second child, and then left Scotland for a period of time for some peculiar reason, and then had the good sense to come back. They then suffer from a stillbirth. Then, of course, there's the census, the 2000 census. So of course, you know all the information about them was collected at that point. And then had a third child. And then they were in hospital for a myocardial infarction. And then got lung cancer, and then they died. So, a pretty packed 10, 12-year period. It gives you some sense of the information that we can collect and have and hold on people who are members of the Scottish Longitudinal study. And what's this got to do with obesity? Well, of course, there are lots of entry points into answering questions that relate to obesity. So just as one example here, in the 91 census, there's information about how this person travels to work. So we know something about the way in which they move around their spaces, their geographical spaces at different points in time, particularly around the census. We also, for example, know information about their height and weight at the time at which they met the midwife prior to the birth of each of their children. So we know something about the individual that are relevant here in terms of thinking about obesity. Just to make the general point, and again, sorry my slides are messed up a bit here, just to sort of explain a little bit for those of you less familiar with longitudinal data, what this sort of information allows us to do is to start to make comparisons of the same group over time. So in other words, to look at particular age effects. It allows us to make comparisons over time, what we might call period comparisons, but it also allows us to make comparisons between cohorts over time. And that's what this graph here hopefully shows us quite nicely here. This is data looking at the proportion, the number of people who are moving in the year prior to the collection of the data. And it shows for 3 different cohorts, so cohorts born at different points in time. So very different effects, very different cohort effects, different mobility patterns between people of different, born at different points in time. But also, for example, shows that we still see the same sudden dipping of mobility, of movement between places that corresponds to the 2008 financial crash. So we start to see how particular moments, in this case the financial crash, affect different cohorts at different points in time. Just to give you a little bit of example of some of the data that might be of interest to people in this network. This is an example my colleague Chris Dibben pulled out for me. This is data relating to travel to work patterns, just picking one particular area in Edinburgh and looking at the people who work in that area and where they commute from. So you can see that there's, of course, a number of people commuting from different points within the city, also some people commuting from the outer suburbs and the small towns around Edinburgh, and indeed some people commuting over from Glasgow. So we can start to think about, we can start to get some insights into particular places where people are travelling to those places, the types of journeys they might be making, which again might help us to answer some interesting questions relating to obesity. This sheet is slightly here, taking some data from England and Wales, as you can see, but this is looking again at travel to work patterns, and this time looking at changes over time. So this is on the left-hand side looking at the changes in the proportion of people who drive to work by local authorities across the country, and you can see quite a clear southeast rest of country gradient with most of London showing that most local authorities in London, there's been quite a significant reduction in the people driving to work, presumably relating to issues such as the congestion charge. Those in London, people in London know much better. But in other parts of the country, there continues to be an increase in the numbers of people driving to work between the 2 most recent censuses. And if you look again on the right, these are people using public transport. We can again see that in some of the urban areas there's been an increase in people using public transport and not so evident in other parts of the country. But of course this is aggregated area level data. This is information that is also available at the individual level, as we'll talk about in a moment. It's not just travel data, of course, there's information relating to health and well-being, information that relates to diabetes. Whilst in Scotland there isn't a diabetes register, so we couldn't identify every individual in Scotland with type 2 diabetes. Nonetheless, there are a number of indicators we might like to think around. Other health-related episode, hospital admissions being one example, mortality outcomes, cause-specific mortality outcomes being another. Prescription data, again, available back over nearly 10 years now. So we do have some information that gives us some insight into people's health conditions, both the geography of that and also over time for individuals. We also have data, for example, from the Department of Work and Pensions, which tells us about a number of out-of-work benefit payments, welfare payments. Tells us something about poverty, about levels of income or lack of income in certain communities, that again, available at the individual level. Just to put this in a little bit more context, this is a little bit of detail about the Administrative Data Research Network structure. There are 4 Administrative Data Research Centres based in Southampton, Queen University Belfast, Swansea, and we in Edinburgh are holding the Scottish one, plus also the overarching network, the Administrative Data Service, which provides support to each of these networks and is indeed the first point of contact for researchers wanting to engage with any of the 4 centres' activities. What does the ADRC do other than live in a very shiny building on the outskirts of Edinburgh? Well, these are the sorts of things that we are working on at the moment, now in our 3rd year of activity. We do a lot of things around engaging with the public and thinking about how we communicate the value of linking data. Of course, this is not a non-contentious area, so we do a lot of work in terms of trying to demonstrate the value of linking data. Not unrelated, we have a whole work package thinking about some of the legal dimensions of what we can and what we can't do, and also how these issues and concerns emerge over time. But perhaps more pertinent to this group, we of course store, access and particularly link large and complex data sets, exploiting new linkage methods. So just as one example, something that I'm working on at the moment, we're currently connecting something called the 1932 Mental Survey Test, which is a test sat by all school students across the whole of Scotland in 1932 at the age of 11. So each of the pupils were born about 1921. So we have some quite rich data about these individuals back in 1932. So what we're trying to do at the moment is link all of those individuals forward to the vital statistics and things that are collected as part of administrative duty and responsibilities, hospital admissions, death, education records, labour records and so on. So we'll hopefully build up quite a rich resource around these children born in Scotland in 1921, or at least were at school in Scotland in 1932. We also, those of you, the geographers amongst you, will be interested in the geocoding, trying to make these spatially specific. We have geocoded administrative data back to the 1850s to the present, and we're developing the means of adding contextual information to individual records. And just by way of an example, we're doing a lot of what we're calling automated contextual mining of, for example, old maps and other resources to try and contextualise some of the individual records, so we know something about the spaces and places that people lived in over what would be quite a long period of time, over 150 years. And we're also trying to think about producing synthetic versions of linked administrative data sets. And the reason for doing this, of course, is that a lot of the information we're working with is highly confidential. It's not easy to gain access to. There are a lot of bureaucratic hurdles to go through to get hold of these data. So what we're trying to do is thinking about ways in which we can provide data sets in a much more readily available fashion. And one way of doing this is providing synthetic data, or synthetic versions of microdata that contain confidential information that are safe to be released as an exploratory tool for researchers. So, for example, you might receive the synthetic data in order to test out your codes, test out your ideas with the latter possibility of then applying your codes to the real inverted commas data. So you can sort of test out and make the errors and mistakes and work out some of the data issues with the synthetic data and then apply it to the real data at a later point. So this is just an example. We have the real data at the top and then the synthetic data at the bottom, and the idea is to make the data look structurally like the original data but contain artificial units only. So you're not looking at real individuals, but nonetheless the data set contains the characteristics, the structural characteristics of the real data set. And this is, for those of the geeks amongst you, this is about replacing original data values with synthetic values generated from conditional probability distributions. What we're finding is that actually our synthetic data seem to estimate the real data really rather well. So this information looking at predicting smoking behaviour, and indeed we seem to get some very close correspondence between the real and synthetic data. So this is potentially quite exciting because it does allow us to release data for researchers and actually hopefully make the whole administrative data research centre activities a little bit more available to a wider community, at least a little more easily. There are other ways in which we're thinking about making the data more flexible, and this one is for those of you who like working in very confined spaces, don't suffer from claustrophobia. The ESRC are investing in what are called safe pods. Currently, the only way in which you can access some of these data sets is by being located in one of four places in the UK, some secure places in the UK. But what the ESRC are investigating is providing a number of these safe pods at locations across the country where you can sit in a dark, windowless room and be heavily monitored as you use the data in your safe location. But as I say, that's for those of you who like working in small dark rooms. Just very quickly, the Administrative Data Service is a partnership across lots of different organisations who provide this rather complex network of particular services that support different aspects of the whole administrative data research investment by the ESRC, whether it be training or legal guidance, different institutions providing different input into that process. So it is quite complicated. But there is an awful lot of help also to help people who want to make use of some of these resources. So I'm not going to go through these, each of the steps that are required in terms of using the data, because it does look rather prohibitively difficult. But I think the key point to take here is there is dedicated help and support for people who want to think about the questions that they might like to ask using this data, want help with considering what might be feasible, what is available, what sort of data might they be able to get their hands on, and also thinking through what are some of the pitfalls down the line, hopefully ways of circumnavigating some of those pitfalls further down the line. There is help and support to guide individual researchers and teams through this process, and my colleagues at the those of you particularly interested in Scottish data, my colleagues would be very happy to discuss those ideas and give you help with developing your ideas if you wish to do so. Various contact details. Those of you interested in the broader network, you can look at the ADRN webpage. You can also get in touch directly with certainly the ADRC Scotland and presumably the other three other ADRCs across the country. But probably the ADRN is your first starting point. And in terms of the longitudinal studies, again, there's some umbrella support for people wanting to use the longitudinal studies, but we'd be particularly keen to talk to people who are interested in using the Scottish data to answer some questions around obesity and indeed anything else, because I think it would be quite a novel use of the data, and I think Scotland provides a really quite useful context to explore some of the questions which I'm sure researchers in this room would be keen to explore. But I think that was it. Thank you.